Yeah, guys, we've been talking about fractures of bones of the hand. I think the first one we spoke about boxer's fracture, which is fracture of the fifth metacarpal. And now we'll be going forward to talk about the blood supply. First of all, the blood supply to the scaphoid, okay, and the fracture of the scaphoid, okay, because it is important to know the blood supply to the scaphoid bone before you know the fracture of the scaphoid bone, because the fracture of the scaphoid bone actually affects the blood supply to the scaphoid bone. Okay, so one thing leads to another, and this is the MBBS Niger, guys. Okay, so discuss the blood supply to the scaphoid bone and the fracture of the scaphoid bone. Right. So guys, this is the blood supply of the scaphoid bone, and basically see that it's talking about the scaphoid bone from this image. This is the proximal side of the scaphoid bone, and this is the distal side of the scaphoid bone. Now looking at this side, looking at this side, you see that the blood supply to the scaphoid bone is coming from up. Okay, so it's not coming from the proximal side, it's coming from the distal side. Okay, so coming from the distal side, you could see that the blood supply is from the distal side. So imagine that there's a fracture of the scaphoid bone here, then definitely the blood supply to the proximal side will be cut off. Okay, so that's just the basis of this lecture. Okay, the blood supply to the scaphoid bone is in 1/3 of the cases enters distally. Okay, the blood supply is from up, just like I illustrated here. Okay, the blood supply is from up. Okay, so that if fracture of the scaphoid is proximal to the point of nutrient artery entry, if the fracture is near the entry of the artery, okay, if the fracture is near to the entry of the artery, the blood supply to the proximal side, this side that is near you now, okay, the blood supply to the proximal side will be cut off. Okay, so the blood supply to the small proximal fragments may be completely cut off, okay, with resultant aseptic necrosis of this part of the bone. Okay, necrosis is like total cut off of blood supply. Okay, so that since the blood is entering from up, if there's a fracture up, then blood will not reach down. Okay, so that's just like the summary of this lecture, and this is the different types of fractures that may occur in the scaphoid, with the fracture in the wrist being the most popular. Okay, the fracture of the scaphoid bone often results from a fall on the hand, on the palm. Okay, you are falling, like maybe you're falling from somewhere, then you support the weight of your body with your palm. Okay, it can fracture your scaphoid. Okay, and it's the most common fracture of the carpal bones. It occurs more commonly across the waist of the scaphoid bone, like I told you guys. Okay, it presents with tenderness and swelling in the anatomical snuff box. I've already made a video on the anatomical snuff box. Is this area of your hand? You can know that your scaphoid bone lies deep to this area. Okay, so if there's anything wrong with the scaphoid bone, it will affect the whole area, right? Okay, so it will present with tenderness and swelling in the anatomical snuff box. Okay, so guys, that's the blood supply to the scaphoid bone and the fracture of the scaphoid bone. Okay, so that's it. I'll see you guys in the next tutorial. Bye for now.